anticoagulants, and insulin. An anticoagulant is a substance that stops or delays the clotting of blood. High alert medications are medications that have a high risk of causing significant harm to a patient if dosed or used incorrectly. An international unit or unit is a specific unit of measurement used for biologicals. Those are drugs that come from living organisms. This describes a standard amount of an individual drug that can produce a given biologic effect specific to that drug alone, a measure of a medication's action as opposed to its weight. Units of one substance are not equivalent to the same number of units of another substance. And patent or patent is open and unobstructed, as in IV lines or blood vessels. Okay. So now let's go over to page 218. I'm not going to read you the entire introduction. There are a lot of drugs that are measured in units, some fat-soluble vitamins like A, D, E, and K, insulins, and of course heparins. Heparins are the anticoagulant drugs that we're looking at. We're especially going to look at heparin. There's something called, let a couple of people in here. Okay, there's something called low, if I can get this thing to write now, low molecular weight heparin. So the word heparin doesn't just describe heparin, but it also describes a whole class of drugs that do the same thing. So LMWHs are low molecular weight heparin, and it refers to the chemical weight of the drug using the chemical formula. And so these are drugs that they don't have the name heparin. They might have something like enoxaparin. The brand name on that one is Lovenox. Okay, so you might come across that later, and so I wanted to make sure I talked about that a little bit. Okay, some of the other high alert medications are things like potassium chloride, and that's measured in milliequivalents. So basically what you guys need to remember is that milligrams are a weight that is the same for every drug. But some drugs we don't weigh in milligrams. So we weigh them in international units, or we weigh them in milliequivalents or millimoles. So if it's units, milliequivalents, or millimoles, they're going to be specific to that drug. So for instance, a millimole of phosphate is not exactly the same as a millimole of something else, okay? So they're not going to weigh the same, they're not going to be anything alike. So we're dealing with apples and oranges with the different drugs. Okay. Insulin is a medication that releases insulin from the islet cells of the pancreas so that it can get into the muscles and release energy. Insulin is extremely important to help control type 1 diabetes mellitus and also some cases of type 2 diabetes. Now, we're not necessarily calling them type 1 and type 2 anymore, because type 2 diabetes, we used to think of it as the diabetes that adults got when they got older if they gained a lot of weight. Isn't that what we've always heard about type 2 diabetes?
Yeah.
Yeah. Well, now we're having 6- and 8-year-olds come into the hospital with what would be considered type 2 diabetes because they weren't necessarily born with it. So, you know, it's very sad to see little kids severely overweight like that. So they're not necessarily calling it adult onset anymore, just because, you know, we're seeing kids with it. What I like is that when they come in, our pharmacists that deal with them and the technicians too, we're not being all judgmental. You know, we're not saying, you know, oh, look, they just got fat. You know, we don't do that because there are so many things at play regarding a patient's weight, and we don't live with them. We don't know what their life is like. And so we have to not be judgmental with this kinds of things. Okay, so yes, most of them are considered clinically obese. Morbidly obese is where their condition causes a severe change in their health. So whether they're obese, morbidly obese, we use that to dose the medications when we dose by weight, which we're going to do in chapter 12. But like I said, we don't necessarily, use it like for judgment calls, because in healthcare, we try not to make those kinds of judgments. And you'll hear people say things, but it's best to ignore it, to say something like, well, you don't know what their life is like, so we have to not think that anyone deserves the health concerns that they're having, because most of the time, nobody does these things on purpose, and it's not their fault. A lot of kids have issues that they can't exercise, kids with asthma, for instance. Okay, so let's look at page 218, U100 insulin syringes. This is the second paragraph on calculating insulin doses in units. U100 insulin syringes are used to administer U100 insulin. So U100 means 100 units per milliliter. Okay, now there are high dose insulins that are 300 and 500 units per milliliter. Most of the time we don't deal with those, because if you don't realize that that's what you've got, you're going to 5 times overdose someone thinking that you're doing your calculations with 100 units per milliliter. So it's much more common to use the 100 units per milliliter. No other syringe is based in units for U100 insulin. So in an emergency, a tuberculin syringe can be used for U100 insulins because it is also calibrated in hundreds of milliliters. So the diabetic syringes for insulin are extremely tiny, and when you pull insulin in one of those syringes, you can actually see it as it comes into the syringe. It makes a concave shape as you're pulling it in, because the needle is so incredibly tiny that it takes the force that it takes to pull that in. You're going to end up with a bubble there. So it's best to pull it very, very slowly. I have a daughter-in-law that uses insulin, and so she kind of taught me how to do this, because a couple of years ago in the hospital, we started drawing up some of the insulins like Lantus for the nursing units. Before that, we would put the insulin in the fridge on the unit and nurses would draw it up themselves. But I think because of issues with wanting the Institute for Safe Medication Practices and the Joint Commission, they want every bottle of insulin to be patient specific, so that no one would accidentally reuse a needle into a bottle of insulin for a different patient. So then we don't have contamination issues. So that's the only reason I can think of, because certainly at least a couple of years ago, most nurses that I worked with were much better at drawing up insulin than me. And it's taking me some time to get used to it, because like I said, it comes in, you need to draw it up very slowly, or else you'll have a lot of bubbles in there, and we don't want bubbles in the insulin. And the needles are already attached. So when you stick the needle into the vial of insulin, it's very easy to bend it. And that's what I was doing when I first started doing this. And in talking with my daughter-in-law, she actually assisted me with learning how to do this, a little bit more skillfully. So, now I feel like an old hand at it, but it took time. Insulin preparations are labeled according to type. Each formulation has a specific onset, peak, and duration of action. So if you look at table 11.1, which is on page 221, all of these different insulins are going to work as far as their onset, how quickly does it start working, and the rapid acting ones, which is Apidra, Humalog, and Novolog, they start working in about 15 minutes, but they only last 2 to 4 hours. Their peak is in 1 hour. The short-acting insulins like Humulin R and Novolin R, they start working in about 30 minutes. Their peak is in 2 to 3 hours, and they last for 3 to 6 hours. The intermediate-acting NPH insulins are Humulin N or Novolin N. Novolin is another drug company. They're Novo Nordisk, and I thought that they had stopped producing insulin several years ago, but now I see that we can still get Novolin. So apparently Novo Nordisk is either still in the insulin business or they sold Novolin to someone else. But at any rate, these are intermediate acting. So if the patient is having a high blood sugar episode right this minute, using Humulin N or Novolin N isn't going to help immediately. It lasts 2 to 4 hours. I mean, it takes 2 to 4 hours to start working, and then it lasts, its peak is 4 to 12 hours, and in 12 to 18 hours, it really stops working. So it's a long-acting insulin. Then we have one called Degludec, which is the generic name. The brand name is Triceba. It starts working in an hour. It says it's considered no peak, which basically means that once it starts working, it doesn't necessarily, like a lot of drugs, if you look at their onset, it looks like this, right? Well, this Triceba is supposed to look like this and then taper off extremely slowly. So it doesn't necessarily have a peak of action like a lot of the other insulins do. Is that making sense?
Yes.
Okay, good. And then I accidentally skipped over Lantus, which is one of the long-acting insulins. Lantus is insulin glargine, and Levemir is insulin detamir. That takes anywhere from 1 to 3 hours to start working, is not considered to have a peak, and it lasts for 24 hours. So the patient would only need to use that one once every 24 hours. Then we have combination insulins. We have Humulin 50/50, Humulin 70/30, Novolin 70/30. The 70/30s are more common. We have Novolog, which is insulin aspart, and Humalog, which is NPH Lispro. The Humalog is 75/25. So when it says 75/25, we're going to look at what that means in a little bit here. Look on page 220, it shows 3 insulin syringes. It shows 30 units, 50 units, or 100 units. So this goes to 0.3 cubic centimeters or milliliters. The 50 units is 0.5 cc's or mLs. And the 100 units is 1 cc or 1 ml. Okay, so those are the 3 sizes of insulin syringes that we use. So for all of these insulins, we only use insulin syringes, and they look different than even the 1 cc syringe that we use that's marked in cc's, because these are marked in units. And the reason for that is it for the nurses? Is it for the pharmacy technicians that have to draw this up, the doctors?
No, I think it's for the patient.
Excellent. Yes, it's for the patients, because patients don't understand the difference between units and cc's. So these insulin syringes are not marked in milliliters or cc's. Okay, so that way they don't get confused, because 30 units is 0.3 cubic centimeters or 0.3 milliliters. So if they're pulling up 30 units, we don't want it to say 0.3 mLs, because that will just confuse them. They'll be like, no, I need 30, and they won't think that that's enough. Okay. Go to page 223 with me right now, and let's look at the picture on top where it shows Humulin N and then Humulin 70/30. And this is important because there's a big question in the post-test about Humulin 70/30. Humulin 70/30 is 70% N and 30% R. Now the R is regular and the N is NPH. Okay, so those are different types of insulin and they mix them in the same vial. So let's look at page 223, and it shows insulin syringes A, B, or C. And question number 1, or practice problem number 1 says, a physician orders Humulin N insulin, 45 units, subcutaneously. What does subcutaneously mean?
Under the skin?
Under the skin, good. So that's why the needle is so tiny and small, because we want it to go into the layer under the skin, into the cutaneous layer. And so insulin is always sub-Q. Which vial of insulin should be used for this order? So you see the insulin A, B, C, and D. So which one should we use for Humulin N?
I think B.
I think you're looking at the syringes.
Yes.
Look at the vials of insulin.
Oh, sorry.
And those start on page 222. So which insulin is this, A, B, C, or D? So up at the top of the page, it says Humulin N, and it shows the label, and that's letter C, exactly. And then the next question is, which syringe? And then your syringes are also A, B, and C, so that's confusing right there. I would have tried to make it E, F, and G or something. So if we want to give the patient 45 units, are we going to use syringe A, which is 30 units, syringe B, which goes to 50 units, or syringe C, which goes to 100 units?
B.
B, because that's a 50-unit syringe. Now, could we use A in a pinch if we did not have any 50-unit syringes?
Yes, we can, but we can use it twice.
Yes, they're going to have to get stuck twice with it. So, you know, we don't want to do that if possible. That's supposed to be a 1. Okay, could we use syringe letter C, which is 100 units?
Yes, we can.
We can, but which one's going to be the most accurate?
B.
B, we want the 50-unit syringe is going to be the most accurate. Okay, so the rule with syringes is that you want the smallest one that holds the amount that you're going to use. Having said that, if I need to give a patient, let's say, 1 entire milliliter of something, and the 1 ml is way down here, by the time I get this syringe pulled all the way down here, I'm going to have this, the barrel, not the barrel, the part of the syringe that goes inside the barrel all the way down here. This is going to be very easy to pull out. So I have a tendency, if I want to give 1 ml of something, to use the 3 ml syringe. And then that just looks to me to be safer. And that's okay too. I have never gotten in trouble for doing that because it's more secure physically to put this in a bag and carry it over to a unit and then have them use it than this one is. This syringe is likely to fall out, so the stopper. Okay, so let's look at all of these on this page. On page 224 are using those 4 labels of insulin and those 3 syringes on page 223, okay? So let's look at Let's look at number 9 on page 225. Okay, so this is how you do all the rest of these except number 9. So let's look at number 9. And number 9 says, a physician orders 70/30 30 units and Humulin R 22 units QAM. So this is going to be every morning. So what vials of medication should be used to supply this medication?
D.
Okay, well, we want to be careful because there's 2 medications that we're using here. Okay, we want the 70/30 and we want Humulin R. Okay, so they're being told to use both of them. So the 70/30 is letter D and the Humulin R is which one?
B.
B, letter B, and that's on page 222.
Yes.
Okay, and
So
then
we can use both of them?
yes, people can mix insulins sometimes. And there's a thing on here about mixing insulins, and I think I might have missed it. Okay, so on page 220, actually it's on page 219. Okay, 219. Way down at the bottom, all insulin formulations can be administered subcutaneously. Only regular insulin and some newer rapid-acting analogs are indicated for IV use. So regular insulin is the only one that can go in, say, total parenteral nutrition. Okay, so if you're going to put insulin in a TPN, it has to be regular. Regular insulin is typically used when insulin is prescribed intravenously. When mixing 2 types of insulin in one syringe for subcutaneous administration, one must be a clear, short or rapid acting solution, and the other a cloudy, longer acting suspension. Okay, so that's a clue. When you're looking at these, the longer acting ones are going to be cloudier. The rule is to draw up the clear insulin before the cloudy insulin. So regular insulin must be drawn up in a syringe before NPH, which is a suspension. If different types of insulin need to be administered at the same time, the same source of insulin, such as DNA or recombinant sources, must be used together. Different sources of insulin cannot be mixed in the same syringe. So sometimes we don't always know, but for a general rule, you want to make sure that you read that paragraph because it tells you which one is which, and you're going to do the clear before the cloudy. So if you look at it and one is clear and one is cloudy, you want to draw up the clear one first. Different sources of insulin cannot be mixed in the same syringe. Lantus and Levemir, 2 long-acting insulins, can never be mixed with any other type of insulin. So when you see long-acting in the middle of the page on page 221, the Lantus and the Levemir, it can never be mixed with any other insulin. Okay, so that's a big deal right there. Okay, so going back to question number 9 on 225, which syringe should be used to administer these medications together? So we want how many units all total?
30. So 8.
50.
Well, we
Oh,
have 30
52.
units of 70/30 and we have 22 units of Humulin R.
Oh, is it 22? Oh,
So
Yeah.
C.
52.
Yeah, so we're going to have 52 units total. So which syringe?
C.
C.
C, which is the 1 ml or 1 cc or 100 unit syringe, right?
Yes.
Because it won't fit in the 50 because there's too many units. We want 52. 70/30 means that in each dose of this insulin, 70% is NPH insulin and 30% is regular insulin. So how many units of regular insulin would the patient receive per day? Well, we already know here that they're getting 22 units, right? Oh, that was
Yes.
good. Okay, so they're getting 22 units of Humulin R. And they're also getting 30 units of the 70/30. And of those two, of the 30 units, 30% of it is R. So let me go back to these. Okay, so we want 30 units of Humulin 70/30. 30 units times 30% is going to be 9 units, right? Nine units of R plus 22 units of regular insulin by itself. 22 plus 9,
31.
31 units of regular insulin, which is the R. Okay, so that's how many units of regular insulin they're receiving per day. And then the next question is how many units of NPH would they receive? So let's do the NPH. Let's, I don't know, do it in orange. Maybe I haven't tried the orange yet. Okay, so we have 30 units of 70%. So if you want, you can change that 70% to a decimal. Okay, so remember 70% is 0.7, so 30 times 0.7 gives you 21 units of R. Does that look correct?
Can't we like 30, make 30 minus 9? It will be 21 because the rest of the 30 is the 70%.
Exactly. That is exactly right. If out of this 30 units, 21 units is, or 22 units is R. No, 9 units is R, right?
Yeah, so,
So
21, the 70%.
yeah, so 30 minus 9 is 21 units of NPH. So that's another way of doing that. So, and remember, not everyone's brain does math in the same way. So it's probably a good idea to use one of these methods and then use the other method to check it, right?
Yes.
Makes sense. So. All right, so now Page 226 talks about calculating anticoagulant doses in units. Now, the heparin and other anticoagulants, we don't use insulin syringes for. We calculate the units in milliliters, and then we use regular syringes to draw it up. But because they're so tiny, so look on page 226. There's a tech alert in the middle. It says, tech alert, heparin is never administered intramuscularly because of the danger of bleeding into the muscle tissue. It may be given subcutaneously and by IV infusion as a therapeutic dose or as a means of maintaining patency of an IV line. And this is what we see a lot. They use the 100 units per milliliter insulin as what they call a flush, and that keeps the vein open and keeps the, because when you have an IV line in a patient, you know, it's kind of like an injury, right? So here's a needle going into the patient's vein. So pretend this is the vein with blood in it. And where that needle enters the vein, it's cutting through the vein. So that's an injury. So the, you know, the blood is going to try to protect it by sending platelets around there. And those platelets can cause a clot, right? So when we use heparin in the very low doses, it keeps the vein open right there so that they don't have a blood clot that forms, sticks to the side wall of the vein, and then ends up causing a heart attack or a stroke or a blockage, okay? So we see this quite a bit. There are some large doses of heparin that are given, but they're usually not given for a real long time. Underneath the tech alert, it says some low molecular weight heparins, such as dalteparin sodium, which is Fragmin, are also measured in units, although some, such as enoxaparin, which is Lovenox, are measured on a milligram basis. The low molecular weight heparins do not have the short half-life of heparin, but they are also primarily administered subcutaneously. Okay, so this is good to know. Lovenox is used a lot of times on women that are in labor or who have recently had a baby to prevent them from getting blood clots that can cause strokes or heart attacks. Having a baby can be a lot of stress on the body system, especially women that have other issues or women that are older. Like, believe it or not, a woman over 35 is considered an elderly mother. That cracked me up because I'm obviously way over 35, and I tend to think of some of the technicians I work with as youngsters. And so one of our, actually our narcotic technician recently had a baby. I think she's about 5 months old now. And it was really funny because she was talking about, well, since I was an elderly mother, and I snorted because to me, she's still a kid. She has like a 6-year-old and then this new baby. She's a young mom to me. But apparently, you know, she hit her mid-30s, and so now they're calling her an elderly mother. So, but we see a lot of elderly mothers, especially using fertility treatments and things. Now women can have babies at an older age. So we're using a lot of things like Lovenox and things like that. Okay, so look at practice problems B. And let's look at number 2. Now this heparin, we have to be careful with heparin because there was a thing in around 2004 or 2005 where the actor Dennis Quaid, he and his wife had twins. I think it was through a surrogate, but I'm not sure. Anyway, they were at an LA area hospital. And I think it was Cedars-Sinai, but I'm not sure. So I don't want to, you know, accuse anyone of anything. But apparently at one point, these twin babies that were born early and were in the neonatal intensive care unit got the wrong dose of heparin. They got a dose that was about 1,000 times more than it should have been. And they almost died. And so it was a very big deal. And if you look at these labels on page 227, and then turn the page and look at the labels on 229, do you see how the heparin 10,000 units per milliliter is brown, and the heparin 20,000 units per milliliter is red? And they also, believe it or not, they make a heparin 100,000 units per milliliter. Now, if you are someone who has an issue with judging colors, you know, like color blindness, this could be a problem, especially since these numbers are so tiny, and these labels are actually enlarged. They're much smaller on the actual vial. This vial here is actually about, yeah, it's about 10 times larger than the heparin vials that we usually deal with in the hospital, which means the label is bigger as well. So we have to be super careful with these. And what they've started doing now is enlarging the numbers, like 10,000 USP units per milliliter. They'll print those larger so that it's easier to see. And they're also changing the labeling so we don't rely so much on trying to figure the difference between brown and red and burgundy, because one of the labels was burgundy, which looked incredibly close to brown. Okay, so let's look at these practice problems B, and let's look at number 2. Number 2, a physician orders heparin 1,000 units subcutaneously. So this is number 2 on page 227. And then your vial is 10,000 units per milliliter, right?
Yes.
So your supply. So are we going to need a whole milliliter?
No.
No.
No, not at all, are we? We're going to need about 1/10 of that.
10.
Yeah. So let's go ahead and do the math so we know where to put our decimal point. 1 ml contains 10,000 units. And be real careful with your, don't worry so much about how you spell the word unit, but be real careful with your zeros. And I want to give the patient 1,000 units. Okay, so here I have 1 times 1,000 is 1,000 divided by 10,000 times 1 is 10,000. And what do I get with this?
0.1 ml.
0.1 milliliter, very good. And then it says what volume should be administered on your on the syringe that's underneath that label. So if you're going to put these on another piece of paper, that's perfectly fine. Just realize you're going to have to draw the syringes and draw the markings. So where are we at with 0.1 milliliters on that syringe? Is it between the 0.2 and the 0.4?
No.
Where's it going to be?
Less
Before
than
0.2.
Yeah, it's going to be about halfway down between the hub of the syringe, which is where the needle attaches, between the hub and the 0.2. It's halfway down there. So I'm not a great artist, and I'm especially bad with this lovely drawing pad that I purchased. So here's the hub right there. That's where the needle attaches to the syringe. Pretend there's a decimal point there after the 0, and we want it about halfway down, so it's going to look like this. So now when you inject it and the needle, I mean the rubber stopper looks something like this, you want to pull this rubber stopper okay, let me do it this way. There we go. So that you have it right at the 0.1, which is not actually marked on there, but it's halfway between the hub and the 0.2. Now, when this gets pushed into the patient, it only gets pushed up to this point right here. So all of this stays in the syringe, so we don't worry about it when we pull it out. We go ahead and make sure that it has liquid in it, but it doesn't really matter. we don't have to count it as overfill. Let's look at page 229, number 5. So this says a physician orders heparin sodium 17,500 units subcutaneously. So that's my order. And my supply is how much?
25,000, 20,000 units.
Oh, this one's funny.
Okay, my my pen is suddenly no longer working. Okay, let's try this.
It is 0.85.
Okay, yeah, that's correct. So one of the things I want you guys to get used to doing is looking at it and estimating what you think your answer is going to be before you even do the problem, because it's very easy to look at these things and think that an answer looks correct when it's not. We know we want less than 1 milliliter, right? Because 1 milliliter would give us 20,000 and we only want 17,500. If we had half a milliliter, we'd only have 10,000, right? We'd have half of 20. So our answer has to be between 1/2 and 1 milliliter. And if you do this before you do your math, then if you make a mistake in your math, you're more likely to recognize that you have made a mistake. Does that make sense?
Yes.
Okay. So doing the math, 1 milliliter contains 20,000 units. And I want to give the patient 17,500 units. So that's going to give me 17,500 divided by 20,000. And using my calculator, my lucky old TI calculator, .875 milliliters.
For these problems, since it's kind of somewhat has to be exact, do you still want us to round to the 10th?
No, on these problems, I want you to round to the 10s, hundreds to the thousandth place.
Okay.
Okay, which is going to be the 3rd decimal place. Now, if it only comes out to say 0.8, don't give me 2 zeros after that, okay? Just 0.8, because we don't want trailing zeros. Okay, let's look at number 12 on page 232.
Oh, sorry, Professor, just real quick on that previous problem.
Yes.
For the syringe, did you want us to just indicate that?
Yes.
Like 0.88 then?
Yes, so when you draw this up in your syringe, let's see, that was number 5. Yeah, when you show it on your syringe, it doesn't show 3 decimal places, does it?
No.
So you're going to have to pull it up to 0.88, which is going to be the closest you can get. Now, there are times when I've looked at something and I went, okay, I could draw my level to the bottom of the line, or I could draw my level to the top of the line. But really, you know, you're going to do the best that you can given the limitations that you have, okay? So if you were to round that to 0.88 on your test, I would accept that. But I would really want to see the third decimal so I know you did the math right, okay? And thank you for asking. That's a great question, and I meant to cover it, so that's good. So let's look at page 232. Did I say number 12? Yeah.
Yes.
Okay, so let's look at 232, number 12. So the order is for heparin 600 units, subcutaneous stat, and my supply is heparin 1,000 units per milliliter. So I'm going to start with my supply. 1 milliliter contains 1,000 units. And my order is for 600 units.
0.6.
600 divided by 1,000 is 0.6 milliliters. Okay, now can you do this using ratio and proportion? Did you get 0.6? If you got 0.6, then yes, obviously that's working for you. So don't worry about, I'm not doing it exactly the way Mrs. Lopez does it. It doesn't matter. You know, as long as you get the correct answer, then your math is working for you, and, you know, however you want to do it. The other way we can do it is to take all of our supplies and make sure that they're over 1 milliliter. If they're over 1 milliliter, then you can always do want over have or order over supply, but they have to be over 1 milliliter. So in this case, my order is 600, and that's what I want. My supply is 1,000, and that's what I have, and I'm still going to get 0.6 milliliters. Okay, so don't look at my math and say, oh, I don't do it exactly the same way. But I want you guys to show me your math when you turn in your homework, because I've already given you the homework key, have I not? So you can check your key. And I do have to tell you that there are a few mistakes on the key. We found 3 mistakes last semester, okay? So there are a few mistakes on the key. So if you're not quite sure of something, then you always want to, you know, double check that. And if it looks like you're correct, let me know, because I've already told Elaine Beal, you know, the mistakes that my students have found, but she needs to know if there's more so that she can correct that for the next edition. Okay, on page 234, there's a review here. Insulin, anticoagulants, and some antimicrobial agents are supplied in units per milliliter. Dosage can be calculated using dimensional analysis or ratio and proportion. Insulin products are available in a wide variety of preparations, mainly in U100 strength. Heparin is supplied in a wide variety of strengths. So you have to read the label and the physician's order carefully with either product and prepare the medication that has been ordered for administration in the proper strength and dosage. And then the technician note, the important key in working with units is the careful interpretation of the label to ensure that the exact amount per milliliter is known before preparation of the dose is given. So double check your supply. Make sure you're doing the math for the label that you're actually going to use. And then the tech alert, parenteral medications in units per milliliter are specific to the medication being used and are not interchangeable between units per milliliter of other medications, okay? So your post-test on here only has 10 questions. And then of course you're gonna tell me which syringe you're using and draw on the syringe where you're going to draw up that amount to. Okay, do you guys have any questions about this chapter or any other chapter?
No, but I have a question for the transcribe the prescription, the three prescription.
Yes.
You just want to write the prescription, that's it, and calculate the amount of the tablets that we use.
Yeah, I had the prescription that I used here somewhere, and it's gotten misplaced because I was teaching my other class this morning. Yeah, so there's 3 prescriptions on there. So I want you to tell me the brand and generic name of the drug, translate how you would put that on the patient's label. So you want to make sure that you have, you know, your verbs and your route. So if it says, let's say it says some drug name, 1QD, I want you to tell me first of all, the brand name, which is, I think, the way it's written.
Yes,
And then,
the generic name.
and then the generic name. So you can put the generic in parentheses. And then I want you to put put like you would put on the label for the patient, take 1 tablet, and then what's the route for tablets?
Yes.
By mouth. Okay, so I'm getting a lot of stuff that doesn't include either the verb or the route. So remember, if it's not on the prescription, those are the 2 things that you're going to add. And that's the only thing you can add to prescriptions, by the way, when we type them up. We can't say, you know, for pain if it doesn't say for pain, or for blood pressure if it doesn't say for blood pressure, even if it's clearly a pain medication, because the doctor didn't write that on there. So this particular SIG, where we don't know the name of the drug, it would say take 1 tablet by mouth every day. I cannot write today. I apologize, you guys.
Okay.
I think it's the way this computer is set on the counter here. It's at an awkward angle. I'm gonna have to fix that. I always say that, and then by the time we get everything fixed, I'll be back in class, right? And then I'll be writing on the whiteboard again. So.
I have a question, Professor.
Sure.
On the post-test for 11, it gives us instructions to round doses less than 1 ml to the hundredth place.
Okay, so.
Right under post-test.
So let's see, chapter 11 post-test. Okay, and I told you to go to 3 decimal places, is that it?
Yeah.
Okay. Well, what I say overrides the book. However, I really don't care. Okay. I mean, I like super accurate numbers because I'm a little bit of an OCD person that way. But in reality, you're not going to be able to pull that syringe to 3 decimal places. So give me 2 and I'm fine. Okay.
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 Anybody else have any questions? All right, so if you don't have any other questions, that's all of chapter 11. Now, what I would like for you guys to do is preview chapter 12, read the first part of chapter 12 before next week if you get a chance, because chapter 12 is going to be a little bit more involved, and we're going to learn a few different ways of calculating patients' medications by age, by weight, and by body surface area. So, you know, it's a good idea to read it a little bit and sort of familiarize yourself with the terms before we start actually in on the chapter. And this is really, chapter 12 is where the fun stuff starts. So, okay, so if everybody's good, then I can go ahead and end.